Quercetin supplementation decreases blood pressure in normotensive and pre-hypertensive patients. So it had blood pressure lowering effects overall. Now, if you've watched any of my crash courses, I've talked about numerous other nutrients, including magnesium and CoQ10 and arginine and vitamin B1, all affecting blood pressure, lowering blood pressure anywhere from 3 to 5 points, and this is systolically or diastolically. So when you have an additive effect, when you start combining these things, if you're jumping to blood pressure medication, keeping in mind that blood pressure medication comes at a cost, most of them deplete nutrients, especially CoQ10. Many of them deplete magnesium. Many of them deplete B vitamins. And so when you take a medicine to lower your pressure that causes deficiency of nutrients that also help to regulate your pressure, add that to quercetin. There's been a lot of debate in the literature and also online about people going carnivore versus plant-based diets. And again, one of the things you're not going to get from a carnivore diet is quercetin. This is why I'm a bigger and stronger believer, not in just full carnivore or full plant-based. I think we have a variety of foods because there's a variety of benefits to both sides. But at any rate, quercetin can lower blood pressure. Definitely been studied. We look at some of the other trials that have been done in humans. If you look at this diagram here, this is a summary of several. But you can see here on the left, T2DM stands for type 2 diabetes mellitus. So this is basically sugar diabetes. And they studied in this one 72 women, 35 to 55. They gave them quercetin or a placebo. The dose in this study was 500 milligrams of quercetin 1 time a day for 10 weeks. And what they find, it lowered systolic blood pressure. It also lowered interleukin-6 and TNF-alpha. These are inflammatory chemicals. It improved total antioxidant capacity, and it lowered oxidized LDL, which is the type of LDL that's been damaged, and it lowered fasting glucose. So it had an impact and multiple effects in diabetics. We can see another study here on type 2 diabetics, 24 patients, quercetin at 400 milligrams once a day, lowered postprandial hyperglycemia, so basically it lowered blood pressure very quickly after a meal.